Uplifting 98.5 KTIS. So proud to have Hanna Pryor join us this morning, the program director at Presbyterian Homes and Services. Welcome, Hanna.
Thank you. Good morning.
Good morning. It's so good to have you here because you understand what our seniors are going through, especially during the pandemic. You've been critical to helping seniors feel connected, feel engaged at Presbyterian Homes and Services, and we honor and admire you greatly, Hanna, for all you do there.
Thank you. We truly feel like we're honored to serve our residents, so thank you for that.
It's so incredible. So if somebody listening has a parent that seems maybe depressed or seems to be going through a difficult time due to the pandemic in particular, how do you talk to your parent about that, or an aging family member or an elderly friend? How do you have that conversation?
Sure. And, those are very difficult things to talk about, and sometimes they can be uncomfortable. So I think that acknowledging that mental health affects everyone differently and comes about in different ways. Sometimes those that are struggling with mental health stop taking care of themselves or their households, or sometimes it comes out as anger or numbness. And so asking them how they're doing, checking in on them frequently, meeting them where they're at. Maybe some days they want to talk and other days they just want to listen to you talk. So call them, support them. We've seen that people within our communities have fared better mentally and emotionally during these difficult times because they've had not only the support of their family, but the support of others around them. So support is really key.
What I love about what you do at Presbyterian Homes and Services is that you engage the elderly with activities. You've had to, what's the word? Pivot. Everybody says we're going to pivot.
Yep.
Right? It's like, okay, that's going to be like a Scrabble word now everybody's going to use. But you've had to do that in the past 12 months. And what are some of the ways in which you've done that successfully to engage seniors?
Yeah, and it's ebbed and flowed. So sometimes when we've had to be a little bit more strict with the visitation policies, that's really, really difficult. But we've done everything that we can, whether it's staff helping residents with window visits or having virtual bingo given to the residents within our walls. But right now, it's wonderful. It's such a sense of community. All of our dining rooms are open. Activities are happening. Chaplains have access to our residents to talk about kind of the things that they're feeling. A lot of these things, we still have to be 6 feet apart and we still have to wear masks, but they're happening in our communities. And we really do look forward to the day where everything is back to normal. But right now, doing the best that we can by having all of different opportunities for our residents and those in our community is what we've really strived to do. And I think we've done a really great job of it. Our staff is really dedicated to serving our residents.
We're speaking with Hanna Pryor, program director at Presbyterian Homes and Services. And she really does understand the issues facing our elderly and how to best help them. Hanna, is there any gold that you've seen, nuggets of gold out of this time that have come out of this that normally wouldn't have come up or come out of this pandemic time?
I think even though we've been apart, the unique sense of community where people come together and they have this different light in their eyes where they're not taking things for granted anymore. Mm-hmm. We are loving our loved ones harder and we cherish them more. And, a visit to our parents means so much more these days because we aren't able to do it regularly. So I think that is really something that we just cherish our loved ones so much more.
And we're talking today about understanding issues facing our elderly and how best to help. Christy.
I'm wondering if we should be talking with our elderly parents about death and their fears. I hesitate to bring it up, but I'm not sure.
All right, Hanna, what do you say about that? Talking to our elderly parents about perhaps eternity and maybe some fears of dying, that kind of thing.
Absolutely. An amazing question and one that I think is on the minds of a lot of people, especially when they have elderly loved ones. And my advice is that it's okay to ask hard questions. And that's a really difficult question. But if you don't ask them questions, how are you feeling about it? Do you think about it? You're opening a door for them to discuss feelings that are difficult to talk about. But if you bring it about in a way that it comes off as this is a safe place and I want to talk to you about these difficult topics and talk through it with you and hopefully, help to process some of these feelings that you're thinking of, that I'm thinking of, and we can kind of come together and pray about it and really get to a place where everybody's comfortable, because it is a difficult topic, but it's a beautiful It can be a beautiful experience.
Wow, that's so good. And you have to have an emotional highway or pathway in your own heart to be able to open that up to begin with and then tap into the other person's feelings about it. And sometimes those are difficult conversations. Hanna, talk a little bit about how to intersect faith in God along with talking with elderly parents in particular about difficult conversations. We talked earlier about sometimes they have to give up maybe things and freedoms that they're used to. And how does God intersect with what you do there at Presbyterian Homes and with you as you minister or counsel people?
Well, God is at the center of everything that we do at Prez Homes. Our mission is to enrich the lives and touch the hearts of older adults, and that is the core of everything that we believe in. And so it's really an awesome organization to be a part of, and I feel blessed that I am able to be someone who is at the table with everyone. And we start every single meeting with prayer. And so I think going back to that with your loved ones and before a difficult conversation, asking them to begin, your conversation or with prayer or end it with prayer. Ask them, is there anything that you want to pray about? I would love to pray with you, because I think that just in a way lifts some of that heavy burden that can be on people's hearts when you start and end everything with prayer. It's a beautiful thing.
Sure. We've heard it said that a lot of people are living kind of in the sandwich generation.
Mm-hmm.
Would you talk about that a little bit and the challenges that come with it?
Yes. So the sandwich generation is individuals who have kids that they're caring for, and now they're also caring for older adults or their parents. And it really does. It puts them in the middle of caring for two very important demographics in their life. But how do they do that? How do they juggle it? And I think it's really important to know that you can't do it alone. So to partner with those that surround your loved ones, other siblings, their care team, kind of a community to help you navigate not only the day-to-day, but definitely these difficult times. So leaning on those around you to help. And I remember, we have a lot of interactions with residents that stick with you for years and years. And I remember years ago that daughters were coming in with their mom to tour our communities. And they came back probably 8 times before mom finally moved in. And it was dramatic a few months later when they stopped in my office and said, we just can't thank you enough. You removed the burden of us caring for our mom, and you gave us the ability to just be mom and daughter again. And it's just, we are at a place where we couldn't be happier.
Aw, that's got to be so rewarding and so fulfilling to have been a part of that story, Hanna. Wow.
Yeah, it's wonderful.
That's great. Okay, just before we run, somebody's listening. They're in the sandwich generation. They're raising teenagers. They're caring for their older parent as well. Give me 2 or 3 self-care, helpful advice, ideas, or tips that they can do to self-care for themselves during this time.
Sure. Well, definitely take time for yourself, whether that's time of prayer, just time of silence, whatever kind of fills your cup. Make sure that you do that, because you are no help to someone else if you haven't helped yourself. But I also think that leaning on others, you don't have to do this alone. Caregiver burnout is something that is very prevalent, and even more so these days. So make sure that you're leaning on others around you and getting the help that you need so that you can help other people.
Oh, it's so great. So great. Hanna Pryor, Presbyterian Homes and Services. You've been a wealth of information, knowledge, and help. We can't thank you enough.
Thank you so much for having me.
Yes, absolutely. More information is on our website at myktis.com. And Hanna, information is at Presbyterian Homes as well?
Yes. If you want to visit our website at prezhomes.org, we have an abundance of resources that we update regularly for everyone.
All right, there you go. Hanna from Presbyterian Homes and Services. God bless you and all you do.
Thank you. Same to you.